guys, we are in the open door green room. Dr. T is visiting us this Monday. She's keeping us healthy and giving you some questions to ask the doctor next time we have a visit. We're not going to waste our time. We won't sit silently. We're going to make the most of that appointment.
Make the most of the appointment.
Okay, so some good advice for your health coming up after the break.
So let's be honest, none of us really like to go to the doctor, but it is important to be proactive. I'm okay now. I've worked through it. Olivia is not just out at me. Dr. T, I like going to the doctor, right?
Don't be one of those, Yenna. We know you're a mother, you're a wife, your family needs you. You must take good care of your health, and that means going to your regular doctor's appointment. When it comes to women's health, sometimes we have a lot of questions to ask, or we know we're not quite feeling well. We don't know how to address it. So to guide us through those conversations, Dr. Sharon Thompson is joining us this morning with some top questions that you should be asking your OBGYN. Oftentimes, Dr. T, that's the only doctor that you have any regular relationship with, right?
Yes,
so it is very important to really make that connection and have those conversations.
Absolutely. So most women in this country make a relationship with an OBGYN because they identify, I'm a woman, I should have one. But a lot of times they don't use their OBGYN as broadly as they should.
Okay.
Because OBGYNs can be there for all those primary care questions that you have. They may not manage the issue, but definitely you want to be bringing them up. So we were talking earlier about a lot of women miss thinking about heart disease. And in fact, heart disease is the #1 killer of women in this country and has been for decades. But it slips over the radar. We think of breasts, we think of pap smears, but we miss that. That's the #1 thing I want you to be talking about with your OBGYN.
And how do you assess your risk of that? Just lifestyle-wise?
It depends on your age.
Okay.
So most things, age is going to be an important factor. And what you want to think about and talk about depends on age. So young women are going to be in reproductive age. And actually, pregnancy is important to think about when you think about your heart health.
Okay.
Because some conditions in pregnancy will be predictors of your future heart health.
Oh, okay.
So, for example, lots of women have heard about high blood pressure in pregnancy or preeclampsia. And women who get those conditions actually have a higher rate of going on to have heart disease. So it's so important to talk to your OBGYN and all your doctors about your history during pregnancy. If you plan to become pregnant, you want to talk about what's your family history of heart disease, because your heart changes. You can imagine you're growing a new human. Your heart's doing a lot more work. And so your heart health is super important if you're thinking about getting pregnant. So hearts and OBGYNs go together.
That's so interesting. I mean, you think about family history as being an important predictor regarding cancer risk, but I haven't really heard of that conversation regarding your heart.
Exactly, regarding your heart, regarding your pregnancy. So that's an important thing for women to think about, and we often don't associate those things, your heart health and your OBGYN, but I want to get you thinking about it.
Okay, and then what other conversations should you maybe be having that seem like, you know, wouldn't be the automatic during that annual exam?
Mental health. That's another one that goes past the radar, but if we think about it, that's the base of our quality of life, is our mental health. And so lots of folks will not bring up those questions with the OBGYN or those issues. I'm feeling sad, I'm losing interest in things that I used to be interested in. But it's so important. Again, also can impact pregnancy. Women who have postpartum depression are more likely to go on to have depression later on. And so these things are related, but lots of times folks don't make that automatic association.
Now that we talk a little bit more about postpartum, do you find, is protocol kind of changed in terms of how to handle the follow-up visits with new moms?
So that's a great question. We're talking now in OBGYN about the 4th trimester.
Okay.
So baby is born and you still want to pay close attention to that mom because her body's still changing from having been pregnant now to going back to non-pregnant. And one of the things that can come up for moms is mood changes. So we really want to keep a close eye out for those and pick up those women who can have symptoms, because, you know, women, we all know mom does everything. She does it with a smile. She has to keep the family together, and she neglects her own health. So a lot of women won't admit it. They won't say. They'll just try to keep going.
Right.
And so we want to pay close attention to that in the office.
And what about nutrition and diet and exercise? Is that something that you broach in your office during a well check?
Yes. Oh, everyone who comes to my office is sick of me talking about diet and exercise.
Like Dr. T, it was just one hamburger. Come on.
No, hey, you can have a hamburger, but it's a treat.
Okay.
And treats are things that you don't have regularly, right? So hamburgers are treats. Veggies are for every day, every meal.
All right.
Yeah. So I'm a broken record on nutrition and exercise.
Well, today I think is National Eat Your Veggies Day, so a little bit later we're even going to try to get that guy over there to eat some vegetables. Yeah, it's going to be a sight to see. So wish us well, because he might lash out a little bit. It's not out of his comfort zone, definitely.
By the way, Dr. T, the hamburger is a staple. It's not a dessert.
I thought that was protein.
Yeah,
once a quarter.
Once a quarter?
She is tough.
Wow, I don't know if you could be my doctor.
Thank you so much. Central Phoenix Obstetrics and Gynecology. She doesn't see patients like you, Scott, anyway, so you're safe.
That's true.
Dr. T, thank you so much.
Oh, you're welcome.
We'll see you soon.
Thanks for having me.
We'll take a quick break. More Good Morning Arizona coming right back.